All right, welcome back. Our favorite dentist is in the house, Brian Dunlap. We are talking about probably my vice, if you will, sweet foods and what they do to your teeth.
Yeah.
How bad is a sweet tooth?
Yeah, well, you know, we want to talk about all foods today,
Okay.
but that's probably the number one thing you're obviously going to hear dentists talk about. Please cut back on the sugar.
Yeah.
Especially, there's certain little beings that really like it more than most, and you now have one in your house.
That's true.
Yes.
Babies, kiddos.
Children. They love it. They love it, love it, love it. They crave it. And so it's really important to kind of try to keep it in, you know, a normal level. I'm certainly not going to ever tell anybody, oh, don't ever eat anything sweet, because that's unrealistic. But just kind of, you know, make sure that you keep it in check, and also try to brush your teeth within a decent amount of time after you eat a lot of sweet things. Sugar can combine with the bacteria that's in your mouth to cause acids that cause tooth decay, and that's how you get cavities. I mean, I know most people know that. You've heard that most of your life. But
Well, let's look at some of the pictures that you brought along, some that are rather graphic, if you will.
Well, that is actually a picture of gum disease. That's not tooth decay that we're worried about here. These gums are very, very red and swollen and angry, and there's some syndromes that can cause the, lack of care, obviously, is the number one cause of this, but there's also some just dietary problems that can cause some real gum issues.
Is that because of not eating the right thing or not flossing, and you're in this area? And
well, again, the most common thing is just lack of care, not flossing, not brushing, not going to see your dentist ever. You know, those are things that can lead to that. But also, just if you have a really poor diet or a lot of vitamin deficiencies, certain vitamin C deficiencies, a lot of the B vitamins, you don't get them, they can do a lot of problems to the tissues in your mouth. We'll see all sorts of issues if you're really having a poor diet. And then these days too, one of the things that's common is these fad diets.
yeah.
People are, doing nothing but grapefruit for a week or something. Yeah, and you can have deficiencies of some other things that you might need, and it can cause a lot of problems in your mouth and obviously other areas in your body. So, it's certainly important, as everybody probably realizes, your diet has a big effect on your body, but also on your mouth.
All right, so we've got something else. This is the I guess the splice of a tooth, if you will.
Yeah, it's just talking about when your gums get recede away from your teeth, you have this little pocket here where bacteria can get down and hide. And what it does is that bacteria causes, poisons and toxins that causes the gums to recede.
How do you beat that?
Well, again, the main thing is just care. Brushing. When you're brushing, make sure you brush around the gum line really well. Make sure you're flossing. Flossing is the one thing most people seem to be allergic to.
I swear, every time I do it, I break out in hives, I cough, and I sneeze, and I've got an appointment next week, so I probably need to get on.
Again.
I think I'm going to let him beat me at golf tomorrow. We'll let you know about it next week.
That'd be nice.
I never